Good morning, good afternoon, good evening, wherever you are, and welcome to this TechNet 21 webinar. Please use the chat to introduce yourself and tell us where you are, and welcome. Today, I'm happy to welcome Van Brigden and Solokone from WHO HQ, and Michel Zeidel and Olamide Folorunso from UNICEF. The topic we're going to discuss is strengthening immunization supply chain with the Effective Vaccine Management, EVM, assessment tool. This session is interpreted into French. I'm going to explain in French how to use the interpretation feature, so bear with me. 20 seconds of French. Pour l'interprétation en français, veuillez cliquer sur le globe en bas de votre fenêtre Zoom, puis sélectionnez français. Vous pouvez aussi couper le son original en fond en cliquant sur couper l'audio original. Concerning this webinar session, you can ask your questions during the webinar by using the Q&A or the chat box. Please use the Q&A preferably. Your questions will be answered after the presentation during the Q&A session. We are recording this session and we will share the links to the video and the presentation by email with everyone who registered. But before we start, just a few words on TechNet 21 for those of you who are not familiar with our platform. TechNet 21 is a platform made for immunization professionals around the world, and it was established by WHO and UNICEF in 1989. Next, please. Our goal is to improve immunization services by bringing together immunization professionals at every level, in every country, from every sector. Next, please. We have quite a large community, more than 5,000 immunization professionals on the TechNet platform. They all come from all around the world, more than 100 countries. And on the platform that we use, so the TechNet website or the Telegram channels that we manage, we use those channels to connect and make new contacts, ask questions, provide answers, share knowledge, join specialist communities of practice, participate in upcoming events such as this one, search for guidance, and browse key publications curated by global experts. And for now, Solo is going to tell you more about what is effective vaccine management and why it is so important. Solo, the floor is yours.
Thank you, Alex, and our warm welcome to all the participants from where you are to this webinar, the first series that we will have to share with you. Then if you can go to the next slide. So this will be really the first series of the webinar we are planning just to discuss and to brief you. The title is, as you can see here, what is effective vaccine management, EVM, and why it is so important, will be delivered today. And the second will be, the title will be the planning and delivering EVM assessment, EVM being effective vaccine management, who, when, and how. This will be scheduled for the 9th of June at 3 p.m. Central Europe time. The third is developing, implementing, and validating a successful continuous improvement plan. This is planned for on the 16th of June, the same time, 3 p.m. And the last is what does EVM tell us about the evolution of immunization supply chains from 2010 to date? This is scheduled on the 23rd of June, same time at 3 p.m.
So
these are really the same. Yes.
So can you go back? Thank you. Just there's a slight change for the fourth session. It's not going to be scheduled on the 23rd, but on the 24th. I'm going to send the information anyway to everyone who registered. Thank you.
Thank you, Alex, for correcting that. So the agenda for today will be just the welcome introduction will be made by myself. I'm Suleiman Kone, but my well-known name is Solo Kone. I'm the team lead of vaccine supply chain and logistics within the API team in the Department of Immunization and Vaccine Biologicals, WHO Geneva. And that my introduction will be followed by Michelle. Michelle will be presenting herself. She's the lead of the Supply Program Division. And then followed by Olamide, also working with Michelle, and Dan will be delivering how does the EVM works, working with me here at WHO Geneva. And then we'll conclude with the Q&A session will be facilitated by Alex. Over. So as you know that EVM, which is Effective Vaccine Management, was a global initiative that aimed to improve immunization supply chains. It provides material tools that needed to assess, monitor vaccine supply chain and help countries to improve their supply chain performance. The initiative was launched by WHO and UNICEF in 2009 and supported by all global partners. And here you can see that it's enabled the country just to strengthen this supply chain system that you see that take vaccine from manufacturer down to the service delivery with all the information that going with. And by making these linkages that are assessed regularly, effectively monitored, and continuously improved, that will really contribute to health and well-being to people across the countries and around the world. And this is really the purpose and the target. Next, done. So far, you have seen that we have launched in 2009 the EVM with the version 1, which is the EVM 1.0. And so far from 2009 to 2020, 161 EVM assessments were conducted in 93 countries, as you can see here in this map, and it is distributed across all the region, the WHO region. Of course, the mark bank was in the African and South Asia continent. So it has covered really all the regions, and then the many countries. Some countries have conducted 2 to 4 assessments. So this was really a great experience. We have capitalized by doing these 10 years of EVM conducting, and this has led to development of the new version of the EVM, that is the EVM 2.0. We are going to talk about you today. Next, Dan. So by migrating the EVM 1 to EVM 2, it has been really an expanded scope. And this chart, we've tried that to summarize the component of this EVM. As you can see on the left, EVM 1 was just concentrating on the 9 facility operational criteria at each assessment location, while the EVM 2 has really expanded. In addition to the 9 operational criteria, it has expanded to facility management criteria that was 4 management, M1, M2, M3, and M4, as you can see here illustrated in the chart. In addition to that, also 6 program management criteria were included from R1 to R6. So this detail will be really expanded and explained to you during this series of planned webinar that we have dedicated to the EVM. Next. So starting from 2019, the EVM as 2 assessment has already started, and then the rollout, we are really right in the rollout. So far, 24 countries are already conducted the EVM assessment, and more are in the pipeline to be conducted. 10 are already underway into 2022. On the right, you can see the list of countries that are already conducted the EVM using the EVM2 process, and we are presented in this map in the color red. And in the text box, you can see that how the distribution and the performance of the countries as presented in terms of reaching the 80 threshold, 80% threshold of EVM composite score. Next. So having said that, I will just pass the floor to Michelle for presenting her introductory words for the next.
Thank you. I'm just waiting for those slides to come up. So good morning, good afternoon, good evening, colleagues, wherever you are today. So I'm Michelle Seidel from UNICEF, and I want to tell you a little bit about the Immunization Agenda 2030, the Gavi ISC strategy, and I think how the EVM links up with all of this and why it is so important as well. So in the next slide, please, Olamide. So the Immunization Agenda 2030 is this global strategy that has been co-created together with countries and regions. And really it is the strategy that, if fully implemented, will save 50 million lives over the next decade. So it really is a critical document, strategy, and a very important document for immunization. And it really is designed to inspire action and inform program managers, leaders, etc., in terms of how to design and implement immunization programs throughout the world. So in the next slide, some of the key vision is a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. And this is tightly linked to sustainable development goals as well. So in the next slide, we can see a couple of the impact goals in terms of what the Immunization Agenda 2030 looks at. So there are three key ones that it looks at. So preventing disease, promoting equity, and building strong programs. And there are 7 indicators around this, around saving lives, controlling and eliminating VPDs, reducing outbreaks, and of course around equity, so reaching those communities and leaving no one behind, and of course providing access to all vaccines, and then building strong programs, so delivering across the life course, and of course contribution to universal health coverage. And we can see that the immunization supply chain and supply chains more broadly are really the backbone to all of this and support all these goals in a large way. And so we need very effective and efficient supply chains to do this. In the next slide, we can see that, that there's 7 strategic priorities, and they're informed by 4 core principles for action. So I'm not going to delve too much into this because we have a lot to get through today, but just to say that supply as well as downstream immunization supply chain is featured very strongly in these priorities as well. So whether it is within the immunization programs for primary health care or within supply and sustainability as well. But it is a strong feature that's weaved throughout all of these priorities. Next slide, please. So the Gavi Alliance developed an immunization supply chain strategy, and it is very much developed with us to support the IA 2030 as well. So we had a look at the previous, at the challenges, and really gleaming a lot of the information from previous EVM assessments and what we saw in the field, and could see that inconsistent availability of high quality vaccines and limited reach of vaccine supply chains in underserved populations threatened access and coverage and equity outcomes. So the theory was that if we focused on ensuring data visibility and use, making sure that we had strong and good planning within country that was obviously linked to both donor cycles as well as government budget cycles, and that we had systems that were optimized for efficiency, but as well as to reach communities, and that we had capacitated staff, particularly for the specifically for the supply chain, so that health workers could actually deliver the work of healthcare and vaccinate children instead of fetching vaccines, as well as ensuring fundamental infrastructure and smart integration. We would achieve the impact goals, which was extended reach, availability, efficiency. And then, of course, we also learned some lessons from the pandemic in terms of resilience, responsiveness. And then, of course, we also thought sustainability was incredibly important from a people, a planet, and an efficiency point of view as well. So in the next slide, we had a look in terms of how we could use the EVM in terms of in the full portfolio planning process. So obviously, once the EVM assessment is done, an improvement plan is developed, and I think this is where the critical gaps are identified, and where this would be an important document in terms of understanding how this can be, how funding through this process can be leveraged to fill the gaps in the immunization supply chain. But I think more importantly as well, that the CIP is also used and linked to national strategic health development plans and government budget cycles as well, because we also know that donor budgets are but a fraction of what government budgets are as well. So it's very important that we are raising and mobilizing government budgets as well, and making sure that we're linking these to national priorities too as well. So I think that concludes the end of my slides. I don't think there's any more. So I'll hand it back to Olamide to go through the rest of the presentation. Thank you.
I think actually it's me now to.
Oh, sorry, Dan.
No problem. We changed at the last minute, so let me bring up and share my screen here. Hi everyone. I've got 15 minutes. I'm going to set my timer now because I don't want to go over, but I do have a lot to cover. So I'm going to talk you through now how this EVM tool works from a procedural point of view, and then I'm going to hand over to Olamide, who's going to talk about how you can take the results of an EVM assessment and use that to inform an improvement plan that's going to strengthen your immunization supply chain. But let's start at the beginning. Let's go back to get an overview of the tool itself. So what is EVM? Well, the clue is in the title, really. It's EVM, setting a standard for the vaccine supply chain. And that's what we're doing here. We're setting the standard by coming up with, in fact, 900 or so requirements that set the standard to define an optimal supply chain. But EVM is more than that. It has different components, some of which are very visible, and some of those are a little hidden unless you know the EVM. So I've spoken of the standards, but now let's talk about the other components. The second part is that it's also a questionnaire that is used to assess if a health facility meets the standards or the national program meets those standards. The third part is it's a secure website. And if you've been to the public website, you'll have maybe, or the EVM website, you'll have seen some of the content that's available. And if you have an EVM account, then you'll be able to log in and you'll be able to use the secure website. to create and manage EVM assessments, also to analyze the assessment results and understand which standards have been met at the national or subnational or location-specific levels. So that secure website is where you do all of your analysis and your EVM assessment management. Fourthly, the fourth part of EVM is the mobile app called EVM Assessor. That's the name of the mobile app that we used to administer the questionnaire. Or to be more specific, it's the tool that is used by assessors to collect data at facilities by asking lots of questions to the facility manager or healthcare workers. Lastly, the fifth major component of EVM is that it's an improvement planning tool. This is perhaps the most important part because it can be used to develop the continuous improvement plan based on the assessment findings that is going to be the engine to drive improvements in the supply chain. If you've participated in any EVM2 training in the past, you'll be familiar with this circle diagram, which talks about the continuous improvement process, or CEVM, it's also called. I'll summarize this very briefly. It begins in the top left with the word assess. That's where you conduct an EVM assessment. You collect and review your evidence to identify the strengths and the weaknesses in the supply chain. Moving on from that is the planning process, where you take your assessment results and you make a continuous improvement plan. That in itself takes time and involves many stakeholders and working with other partners to come up with an improvement plan that's realistic and something that's going to be successful. Once you have your plan, you then need to implement it. You need to put that plan into action. That's the third part in purple there in the bottom right. The fourth part, the fourth and final part, is to monitor the implementation of your plan and of your improvement activities to ensure that they work. So to put it another way, you need to assess your supply chain, you need to make your improvement plan, you need to improve your supply chain, and then you need to ensure that the improvements you've made have really worked. And this is a continuous process. And that's why we say that EVM assessments should be conducted every 3 to 5 years. Here is a continuous improvement plan represented as a car. The energy for this car, the power of this car, is hopefully going to come from EVM. The EVM assessment results are going to provide the raw material and the necessary insights and power to make sure that your continuous improvement plan is successful. That's how I see the relationship of EVM and the CIP. So let's get a bit more, let's look into this in a little more detail. And happily, I have, in addition to this 15 minutes, next week, I'll be talking through this process in more detail, and I'll be giving you a lot more practical information on how EVM works. But for now, I'll give you a little taster. So how do we get from the preparation phase at the beginning to the assessment, and then onto the plan, then the implementation of the plan, and then the monitoring of the plan? Let's see. First, we have to conduct our pre-assessment planning, which involves a whole lot of perhaps tedious, but really, really important administrative tasks in order to ensure you set yourself up for success before you even begin this journey. You need to secure the necessary funding to conduct the assessment and to create the CIP. You need to make sure you have the resources in place to do that. You also need to come up with a timeline for these activities, which can be ambitious in terms of a couple of months, or it can take up to 6 months, depending on the size of the country and the ambition of the assessment. You also need to formalize the CIP governance. What does that mean? Well, you start with the end in mind. You don't conduct an EVM assessment and say, job done. What you do, and Olamide will talk about this after me, is that you put in place all of the systems and all of the people and all the processes you need to ensure that your CIP is going to be set up to succeed, i.e. you have the right stakeholders in the room, they're in agreement, everyone is aligned with your timelines and the other processes that you need to put in place to make this happen. After that, you have a few more practical tasks. You need to train your EVM managers so that they know how to create an assessment, analyze the results, and deliver it successfully. You need to complete your EVM country setup. That's the task that the EVM managers will do, and I'll describe that shortly. And then you need to conduct your EVM assessor training. You need to train your assessors how to collect data, how to visit health facilities, and deliver the EVM questionnaire. The EVM country setup is a long process, and I won't go into it in much detail because I don't have time, but to summarize, every country in the world has a private EVM web portal hosted by WHO, and all of the country setup activities related to EVM are completed on this web portal. Once that setup has been completed, the EVM assessments can be created and delivered, and not just one EVM assessment, any number of EVM assessments, 2, 3, 5, 10, as many as the country wishes. And the data collection, of course, as I mentioned, is conducted using the EVM Assessor mobile app, which, by the way, is available for free download in all of the app stores. Just search for EVM Assessor. And that works by an assessor being assigned a questionnaire for a health facility, downloading it onto the device, and then once the assessor has collected the data, the questionnaire can then be uploaded to the WHO database. This is a screenshot of the EVM website, and on the top left are the three horizontal bars that you use to access the menu and sign in. There are 4 steps in the country setup process that have to be followed once a country decides to conduct the EVM assessment for the first time. First of all, you need to create an account. You need to have an account on the EVM website. Secondly, you need to configure country accounts. In other words, you need to give access to your system to the people who are using it. If you have some colleagues in Ministry of Health or other implementing partners, you need to make sure they all have accounts. You need to give accounts to all of your assessors also. Next, you need to complete the country setup, and then you need to actually conduct the assessment. So let's get started. The first step, as I say, is that we have to have one or more national EVM manager for a country, because that manager is going to be the focal point and the gatekeeper of all access to EVM data for that country. And then that manager, as necessary, can assign further access to other managers if they want, or they can take away access, and they can make other users assessors. And once they have that access, they can sign into the EVM website and assign the necessary roles to other users. And there's the URL there at the bottom, extranet.who.int /EVM2/web. Configuring the country accounts. This I'll talk about more next week, but in summary, I'll just explain the different roles that someone with an EVM account can have. They can be an assessor, they can be a manager for a country, they can be a manager for a subnational unit in a country, i.e. a province or a state, or they can be an observer. An observer is someone who can have access to see what the data inside a country setup is, but they cannot edit it. So all of these roles are country specific. So a single user can be an assessor for Angola, a country manager for Bangladesh, a subnational manager for California, and an observer for Tajikistan, for example. And all of the access for every user is role-based, and it's managed entirely by the country manager, thus ensuring that every country has completely secure, controlled access to their data. So once we've got started, we need to complete the setup. I don't have time to talk about this now. I will next week. There are 3 key tasks. 1, we have to add the administrative units for the country. What are administrative units? Well, they're just the geopolitical organization of the country. They are how the country is divided or subdivided. In America, it may be, it's the states. There are 50 states. And underneath that, there are counties, I think. So those are the administrative units for the USA. And every country's administrative units will be different and organized in a subtly different way. Once we've added that, we need to add the locations. The locations are all of the health facilities that handle vaccines or that deliver vaccine services. All that entire hierarchy needs to be added into the EVM system, and this takes the longest part. It's a lot easier if there's an up-to-date master facility list, facility inventory. If there isn't, then one needs to be created. And finally, the vaccines used in the national schedule need to be added. These are the 3 setup tasks. Once this is done, an assessment can be created very quickly. So let's move on. We've prepared, we've done our setup. Now let's start the assessment. We need to create an assessment. Why did I put this picture of a driver? Well, I wanted to illustrate that with EVM2, countries are in the driver's seat, and countries can assess any aspect of their supply chain whenever they choose. Now, in EVM, there is what we call a full national EVM assessment, which is the benchmark, a global benchmark. However, a country can customize their assessment and conduct a different type of EVM assessment depending on their needs. We call these targeted assessments. I also refer to them as flavors, like a flavor of an ice cream. The different flavors that EVM assessments come in are the type, whether we want to use a random site selection to pick health facilities in the entire country, or whether we want to select specific health facilities because we want to assess them very directly. We can also specify the range. We can choose locations from the entire country, or perhaps we only care about locations in a specific area of the country, perhaps one state or one province or one zone. The third flavor is that we can change the sample. We can make a single random site selection for the entire country, or an individual one for each province or state. And finally, we can the flavor we can choose is the scope of the EVM assessment. The scope means whether we are going to assess every component of the EVM criteria, or whether we are only going to assess a subset. For example, perhaps I only care about waste management and I don't want to conduct an EVM assessment for the other criteria like temperature management or vaccine arrivals at the national store. If I only care about waste management, then I will create an EVM assessment that only assesses waste management. And in terms of a workflow, this is what it looks like. The EVM manager, starting on the left, the EVM manager creates the assessment, assigns the locations in the assessment to assessors, and then the EVM assessor, for each assigned location, downloads a questionnaire for that location. Then using the app, they collect the data at the health facility, and then they upload the completed questionnaire. That's the assessor's role. The EVM manager's role is then to review, validate, and approve the uploaded questionnaire, finalize the assessment, analyze the results, generate the EVM report, which can be done automatically in EVM. At least an EVM report template can be downloaded. And finally, download the CIP development tool, which I'll talk about at the very end. Now, so far, I hope you've taken on board that countries can manage and deliver their own assessments, reducing the need for external support with EVM2. This is in line with the core priorities in IA 2030 of country ownership. Once the country has set up their system, they can create subsequent assessments extremely easily, and they can use those to compare performance with previous assessments. The EVM app, of course, is a step up from Microsoft Excel-based data collection in EVM1. Hopefully, when you use it, you will agree. And the final part, just to mention, is that WHO hosts and maintains all of this EVM software. So there's no administrative burden on the country to manage this. Solo has already spoken of the EVM2 framework providing greater clarity on ISC performance with these additional criteria. In EVM1, we had E1 to 9, which relate to facility operations. In EVM2, we also have M1 to 4, which is facility management. and R1 to 6, which is national program management. Here is what we call in EVM2 the heat map. This is one of the main dashboard views or visualizations you can have on an EVM assessment score. And I don't have time to talk about it, but I will draw your attention just to a few things. Number one, on the top, you can see that all the scores in this heat map come from our aggregated scores based on 45 facilities. You can see it says total number of locations included 45. So this is typically what you'd see at the end of an EVM assessment, and it will show you all of your scores represented in cells that their color is determined by their score. If they are less than 50%, they're shown in red. So you can immediately see here, there are some patterns emerging in this, this assessment. On the left, you can see various filters that I could apply if I wanted to. Maybe I only wanted to see the scores at the primary store or the SP, the service delivery points, or in a particular province. Let's just use one very quick example. Let's look at waste management. I mentioned this before. Let's say we want to know what's happening here with this score of 28 in waste management. It's in C5. Which is policies and procedures of waste management. What does it mean, 28%? Well, if we click it, we can see the requirements underneath it, and there are two. The first is that the facility has the required SOPs for waste management, and the second is that there are safe injection SOPs in the immunization room itself, and information on the score is provided there. If you want to drill down further, you click one of those requirements and you see the sub requirements underneath it. So let's click the first requirement there, R0324. There are 3 sub requirements. The facility has safe injection SOPs. It has SOPs for disposal of sharps waste and for management of used vials. So armed with this information, we are now in a position to create some pretty strong and pretty specific improvement activities that we will include in our CIP. Here you can see that there are 900 of these requirements. They're very, very detailed, and I just include a screenshot of a load of them just to illustrate the fact that they're extremely detailed, and they're going to provide you, like I say, with the energy and the power to really make your CIP a success. My last point here, I'm finishing because I'm passing over to Olamide, is that at the end of the assessment, we can now download what we call the CIP development tool. This is an Excel tool that helps prepare for the CIP workshop, and it includes a list of every requirement score, all of the 900 that I just mentioned from the assessment, and EVM managers can use this to generate a list of improvement activities that address the weaknesses identified in an EVM assessment. So I've got halfway through there. I've got halfway through our roundel, and I hope I've sort of illustrated how this process is working to create the CIP. And with that, it's a great point for me to pass on to Olamide, who's now going to talk specifically about the CIP. Thank you very much.
Thanks very much, Dan. Because we still, like Solo presented earlier, we still have a future CIP session. So I won't go into details really about the CIP itself, but give an overview just like Dan just did. I'm Olamide Folorunso. I work for UNICEF headquarters at the supply chain team. So in the next couple of minutes, 15 minutes, just to talk to you about how you can use the CIP, the EVM approach as a continuous improvement process. Like Dan has nicely summarized in 15 minutes, what it entails to do an EVM assessment. It takes a lot. So sometimes you breathe a sigh of relief after you're done, and then we tell you, oh, you're not done. You have the CIP to develop. And after you develop the CIP, you must monitor it. What is that? Why? And so that would be what we'll be discussing in the next couple of minutes. We think that the EVM tool facilitates a mind shift because we want to focus on a continuous improvement process that ensures that we can assess, plan, implement, and monitor how our supply chain is doing. So from our assessment, that's a heavy lift, understandable. We'll still do our assessment. We'll still continue to ensure that we identify the gaps, but more importantly, we want to ensure that we can see that the assessment is just one component of this wheel and cycle that Dan also shared earlier, which starts with preparing in the middle, doing a heavy lift of getting ready for an assessment, but also conducting the assessment itself, to actually having a continuous improvement plan that can then be monitored after implementation to see where we're doing well, where have we improved, where have we not improved, and then the cycle repeats itself. As you would have heard, Dan has said that we encourage countries to do national EVM assessments every 3 to 5 years. You will see later the advantage of EVM2, that you can do targeted assessments that are not full national, that is also subnational, or depending on one or based on one criteria under the EVM framework. So we've gone into this. I think Dan also has talked about it, so I'll jump it. But you see, it's a continuous improvement process. It's not just one thing. The EVM approach, the EVM2 methodology takes you from a point to another point, but also in a continuous fashion. So let's always remember that, and that all the energy we take to the assessment, we also take that through the planning, the implementation, and the monitoring. That is when we'll get the full benefit of EVM2. How do we then leverage the EVM assessment for continuous improvement? Dan introduced you to the heat map. What the heat map then helps you to do is to move from those results, including where you're doing okay, where you're doing well, the green, where you're doing so-so, the yellow, and where you're not really performing as optimal as you want, the red scores. And then that helps you to develop a roadmap, an implementation plan to get to your target. Then how do we do that? Solo introduced this briefly earlier. It's good to remember that the EVM2 is a more robust methodology that contains 19 criteria from an initial focus of 9. What that means is that against each of these metrics, against each of these criteria, improvement plans can be made, improvement targets can be developed, and you can use that to drive where your supply chain should be and what you want your supply chain to facilitate and contribute to the bottom line. So that is critical to understand, that the robustness of the EVM2 affords improvement planning using the scores that you get from your EVM assessment in these 19 criteria. And this is the heat map. Dan showed it earlier. So you see, we can plan improvement costs across categories. So you see categories from your left to your right, and then criteria from top down, E1 to E9 here, and M1 to M4. And you can plan for each of these cells is an intersection between categories and criteria. You can actually plan drilling down. We'll go into detail subsequently in subsequent series. You can plan activities based on that, those costs. You can also plan them on your outputs and performance costs, which is something that I will introduce you to later also, which is an aggregation of what do you see, or what are the results that you see after you make some input or you take some actions in your supply chain. So you can actually have a robust sort of data set that you can use to now say, okay, this is what my supply chain looks like. I know how I'm performing. Where do I then want to go? And then you can use that for your continuous improvement. You can also set targets, so to say, for your criteria and your category, and your composite called the national overview. If you want a 1, so in this slide, you're seeing 82 at the bottom right. If you want a 1 figure that summarizes all what your supply chain looks like currently, that will be that figure. So you can say, okay, in the next 5 years, we want to be at 90. If we are at 82 now. So it helps you. So it's a rich a methodology and data set that affords you to be able to then say, where do I want to go and with my supply chain? What improvements do I want to build in, and how do I do that? So what are the principles and the tools? We've said we want a mind shift from the EVM assessment, just focusing on assessment and having a report and it's being filed away in someone's cabinet or in someone's computer, to using it as a continuous improvement process that goes into planning, into implementing and monitoring. We've said you can do that across the rich data set that EVM assessments provide for you. The question then becomes, how do you do that? What are the principles? Even though we'll go into details in the third webinar in this series, I just wanted to introduce some principles and some tools that would help you to ensure that you can use this methodology as a continuous improvement process. The first principle is that you can't do a CIP just with 2 people, or just with the supply chain team, or just with the EPI team. Everyone, national, subnational, everyone, immunization, broader health systems, everyone's immunization supply chain, beyond that to broader, bigger health, public health commodity supply chain, are extremely important in developing a continuous improvement plan. Beyond the health landscape, beyond immunization, involving folks from other departments, Ministry of Finance, Ministry of Work, some of the things you would interface with in the EVM assessment around infrastructure that you need to liaise with the Ministry of Health, the Ministry of Works, or the Department of Works. Some of them are around sanitation that you need to talk to other people, and everything is premised on improvements supported with finance. So you need to talk to the Ministry of Finance. So the earlier you engage them, even before your assessment starts, in that multi-partner, multi-stakeholder engagement is extremely critical. We can't overemphasize that. Oftentimes, national level colleagues also think that this is something that they can do on their own, but subnational level colleagues are extremely important in ensuring that you can have a very sustainable and useful continuous improvement plan. So stakeholder involvement, critical. Now, you have to leverage global strategies. Michelle talked about this earlier, and we know that at any point in time, the Global Alliance, the Gavi Alliance, has a supply chain strategy. If you remember from the previous strategy, was 4 fundamentals. We're shifting to 6 investment areas listed. Now, those thinking help you to really situate your supply chains in a way that will contribute to the bottom line of health goals that you have. So you see, this is not just, this is for Gavi, it's something that you can take and adapt and use for your own supply chain. So it's important to leverage global strategies, regional strategies, the African Union, the Asia Development Region, the Euro strategy, all the strategies that you can have, both global and regional, will be critical to leverage as you continue to think about using your EVM assessment to drive a continuous improvement process. Now, your health strategies, you can think about global and regional strategies without thinking about your national strategy. So it starts from what are your health strategies, what are your goals. So the EVM is not a standalone activity that you're just doing just because you are interested in, you very much like the fridge and you're an engineer and you want to focus on that supply chain. It contributes to the bottom line, and that bottom line is the health strategies, the goals that you have in the country. So it's important that you review those strategies, look at it, and see what are the recent ecosystem in your health landscape in your country, and what needs to change. And you start thinking about what are the recent investments that are taking place, what are the recent occurrences in your health landscape. So all those things are important. Of course, also equally important is the supply chain strategies in country. Do you have standard? Do you have SOPs? Do you have action plans? What are your CMYP? All that contains some form of vision and direction for your supply chains. You need to bring them to bear as you think about mainstreaming continuous improvement plans through the EVM methodology. Now, Dan mentioned this earlier. We'll go into details in subsequent series, but there's a CIP development tool which you can use, that you get after you complete your assessment, your EVM assessment. You can then use that thinking about, even before the CIP workshop that we'll go into later. I can start to use to define what are the activities I want to undertake to improve my supply my supply chains. And if you use the CIP development tool before, during, and you use it to consolidate during your CIP workshop, and it entails developing a vision. It supports you to develop a vision for your supply chain, because we said you do an EVM assessment every 3 to 5 years. At the completion of one EVM assessment, you want to develop what's my vision for the next 5 years. What are the strategic goals I want to achieve? And generally, we recommend you have 4 or 5 overarching high-level goals for your country. You can, in any case, you can adapt this also subnationally. And then you take the activities you've defined before the workshop, you use that time to refine them, improve them. Okay, your low scores, your medium scores, how do you improve? Even your high scores, sometimes you may want to ensure that you have some activities to sustain those performance. So that's important. And then you develop your targets, you think about your resource requirements, and then what are the procedures that you use to monitor implementation. So this is a tool that we think is extremely useful, that would help you to really develop those plans that builds out of your EVM assessment. Now, like I said earlier, one of the shifts that we have had that's very useful with the EVM2 methodology is that you can do targeted assessments. We know that EVM, the national assessment, takes place 3 to 5 years, but between those assessments, Dan explained earlier, national managers can plan targeted assessments, be it in parts of the country, maybe that is low performing, or that has just received some investment and some improvement activities, or in select criteria, let's say waste management or temperature monitoring or human resource or supportive supervision. You can plan a targeted EVM around this. And what that helps you with, apart from benchmarking specific assessment focus, is also to monitor the progress. So you can say we do a national assessment in year 1, maybe from year 2, every half year, we will do a targeted assessment in specific area. And you budget for this also, because you need funding for that, you need technical assistance for that, and you need to make sure that your staff members or your assessors in country are available to do that. So you use that also as a monitoring metric for ensuring that you can continue to support improvement, tweak where you need to plan activities. Everything we mentioned also can be done around the targeted assessments, including developing those recommendations, including developing those improvement plans using your CIP development tool, including leveraging global, regional, national strategies. All those things are important, and then adapting each of these to your context, even if you do a national or a targeted assessment. So again, the last point I'll make is that every opportunity, one of the ways you can mainstream the EVM methodology is the fact that every opportunity you have to do a national or a targeted assessment, you should use it to institutionalize capacity building, to build more persons that understand the EVM methodology, that can deliver the assessment, but more importantly, that can go through the 4 steps of the cycle. So like I said, this is an introduction of starting with the mind shift from not focusing just on the assessment to moving into mainstreaming EVM and using it to improve the supply chain to contribute to the bottom line, and overarchingly considering both global, national, and regional strategies to ensuring that you can use targeted assessments between 2 major assessments to increase improvements and to ensure that you can monitor your supply chains for progress, and ensuring that efficiencies contributing to the bottom line, reaching the unreached, can be achieved. So that is where we'll leave it at now, and then we'll build it up at the third webinar in this series, where we'll discuss the CIP itself in bigger detail. So I'll pass it on to Fred or Alex.
Yeah,
Alex,
thank you, Olamide. Thank you. We don't have that much time left, actually. We have 4 or 5 minutes for questions and answers. I'm looking into the Q&A box. A lot of questions have been answered in written by Solo and Dan, but let's see if we can answer some of the questions. Let's start with this one. Are EVM tools possible to apply in project-based approach? Example, given short-term or special immunization action in a specific area? Then.
Thanks, Alex. Yes, it's a great question. Thanks for asking that one. The answer is yes, for sure. This has been a key component of the EVM architecture that we said this was country-based and it was people-focused and it's data-oriented. And the EVM tool is designed to be agile. So if you don't want to conduct a full national EVM assessment, perhaps you only want to assess a particular area of the country or a particular sort of component. Maybe it relates to an issue such as a zero dose sort of consideration or some particular angle that you want to look at, what you call a project-based approach. That's what EVM is designed for. And you can either do that within the context of a country, as in you ask, let's choose a country, Algeria, you ask if you can become a manager for Algeria and you want to conduct a targeted assessment in Algeria in one province, or if for one criteria, waste management, for example. Or if you don't want to do that, you just are a highly motivated facility store manager and you want to assess your own store or the facilities that you manage, you can do that yourself today without having to go through numerous administrative tasks. You simply create your EVM account. You use what's called My Facilities, which is your private area for conducting your own projects in EVM. And you can create your targeted assessments and analyze the results, just like it was a full national assessment. So I hope that satisfies you and you're happy with the answer. And we welcome people using EVM in this way, outside of the traditional full national assessment.
Thank you, Dan. Maybe just a last question, because we only have 2 minutes left. Which one? Dan, is there any question you see in the Q&A box that you think is more like has perhaps a lot of relevance? I mean, everything seems relevant to me, but if there's something you think should be really answered.
Yeah, well, actually, several of them look like they're related.
Yeah, indeed.
There's the one on, can the EVM questionnaire be used by countries as a supervisory supportory checklist to be administrative quarterly? Yes, exactly. That relates to what I was just talking about in terms of a targeted assessment that can be created, not a random sample in the country, but specific facilities as follow-up or supervisory checklist, perhaps to identify learning issues or performance issues that need to be addressed. The other one, est-ce qu'on peut installer l'application GEV juste pour un district? Is it possible to have a tutorial on how to create an account? Yes, I'll be covering that next week. And yes, it is possible to have that just for one district, aka a targeted assessment. And the final one, I think maybe I'll pass that one over to Olamide to answer that one.
So Olamide, I'm reading the question for you. Indeed, great information from all the sessions, requesting the organizers to also provide some technical inputs on merging CIP into CMYP in future presentations.
No, that's a great question. Indeed, the CIP should not be standalone. So every opportunity you have to use the CIP and leverage it will be critical. So including the FPP conversations in country that Michelle mentioned earlier, and of course CIP discussion, CMYP discussions. I think that would be great. So we don't expect CIP to be just standalone and they think it's separate, but to be integrated. We'll include it in subsequent ones too. Thanks.
Thank you very much. It's 4 p.m. here in Geneva, so I think we need to wrap up this webinar session. Thank you very much, Dan, Solo, Olamide. Thank you very much, Michelle, who has left earlier. And that was a great presentation. I'm going to share all the slides and recording with everybody who registered to this webinar session. There are three other sessions which are three other sessions which are coming in the next week. I'm going to send all the details by email so that you have everything in written and it's easier for you to find all the information. If you have any other question, you can also reach out to me. You have my email address that you received by email when you registered. I wish you all a very nice day. Thank you very much again to all the panelists, and goodbye. See you next week.
Thanks to all.